When most people hear of ketoacidosis, they have no idea what it is. Diabetic ketoacidosis is a serious complication of diabetes that occurs when your body produces high levels of blood acids called ketones. The condition develops when your body can't produce enough insulin. Insulin normally plays a key role helping sugar, or glucose, a major source of energy for your muscles and other tissues, enter your cells. Without enough insulin, your body begins to break down fat as fuel. This process produces a buildup of acids in the bloodstream called ketones, eventually leading to ketoacidosis if untreated. Some of the first major symptoms of ketoacidosis include excessive thirst, frequent urination, nausea and vomiting, abdominal pain, weakness or fatigue, shortness of breath, fruity scented breath, and confusion. When experiencing these symptoms, you may have to go to the hospital. You'll probably get insulin through an IV to bring your ketones down and fluids to keep you hydrated and bring your blood chemistry back into balance. If you don't treat ketoacidosis, you could pass out, go into a coma, or possibly die. To help with the treatment of ketoacidosis, your doctor may change your insulin dose, or the kind that you use to prevent it from happening again. You should drink more water and sugar-free non-alcoholic beverages. Good blood sugar will also help you avoid ketoacidosis. Sister Caroline, who over the summer had a case of ketoacidosis. I asked her if she would mind answering some questions for me to do this video, and she eagerly said yes and wanted to share her story.
Hi, happy to be answering these questions for you. To answer the first question, the symptoms that I was having before going to the hospital and finding out I was in ketoacidosis, I was unable to keep food down. I was unable to keep water down. I had a headache. Every muscle in my body was sore. So I thought I was just dehydrated. I tried drinking water, tried eating. Didn't help. In fact, I was just at that point throwing up anything that I put in my body. I know, gross, but you asked. And then so my roommate at the time really felt it was necessary for me to go to an urgent care and brought me to the Med Express in the area, and they took my blood sugar. It was only 181, which is pretty low for someone who is in ketoacidosis. And so they asked if I had lower back pain, and I told them that everything hurt, but yeah, I did have lower back pain. They were concerned that my kidneys might be in trouble, or my pancreas at the time. So my roommate brought me to the emergency room at the hospital, like 10 minutes away, and they did a blood panel and told me that I was in ketoacidosis because the carbon dioxide in my blood was extremely high. And so they did a CAT scan of my brain to make sure there was no swelling. I was having a very hard time breathing because I had so much carbon dioxide in my blood. I was panting kind of like a dog, that short kind of heavy breath. And so that was tough, and the doctor came and told me that they would be moving me to the ICU because I was the sickest person in the ER at the time. And so once they moved me up to the ICU, I was on an insulin drip for quite a few days. And they were trying to get a metabolic gap to close. So it was a lot of mumbo jumbo that I don't really remember because I was extremely out of it. They had to test my blood every 4 hours. They had to prick my finger every hour. It was a lot of poking. I have had hyperglycemia. I've been hyperglycemic for about 4 years. August 15th, 2014, I was in the emergency room with high blood sugar, and I had seen an endocrinologist for a while. I was on oral medication, but then didn't seem to have the same kind of effect as this. But so that's been the biggest change, is finding out that I'm actually type 1 diabetic. So insulin and long acting, kind of that basal insulin that I do at night helps me kind of as a backup, and then whenever I eat something I use a short acting insulin to cover that. So, kind of learning how to inject myself, how to know the signs of high and low blood sugar, um, testing before I eat, finding out what kind of carbs are harder for me to process and what carbs are better has been a huge process in learning, especially for teaching. Monitoring my blood sugar has been essential. I've had a couple scary lows while I'm teaching. I've had scary lows at night. I've had some quite high moments when the insulin I had either didn't cover me or I underestimated the amount I would need. But thanks to the scary event of having ketoacidosis and being in the hospital for almost a week, definitely taught me the signs of having an attack of ketoacidosis or going into ketoacidosis. Knowing those signs will definitely help me stay healthy, and keeping myself aware and safe is important. So, thank you.